So actually, if you want the answer to that question, there are only two people in history who went to HBS and Transylvania. The other guy worked in consumer electronics, so went a very different path than him. But it's a pleasure to be here today. You're probably asking yourself, why are they having a healthcare guy come speak at a technology conference? Doesn't healthcare have enough of its own conferences? And I can tell you, after having worked in this sector for over 25 years, healthcare absolutely has more than enough conferences of its own and doesn't need more. But I'm here to talk to you about omnichannel solutions as a way to address some of the healthcare challenges that we're facing in the US. But before I get into that, what I'd love to just say is give you kind of a concluding point up front, which is this. We're going to talk about that the US healthcare system is facing a lot of challenges. There's a lot that ails it today. And from my perspective, I think the way that we're going to address those challenges is through technological innovation and through people focusing on how technology and how innovation can be applied into this system to improve healthcare, to improve access, and to make it more efficient. And we'll talk a little bit more about that today, but if I could ask anything of this room, if any of you are thinking about what should I be doing next, if you're interested in technology, but you're thinking about what do I go do, where should I focus, I would tell you focus in on healthcare. And so again, I want to go back, before I talk about omnichannel, I want to get a little more basic, and I'll apologize for this, but as I mentioned, I've worked in healthcare for a long time, and there isn't a day that goes by that I haven't heard somebody tell me that the American healthcare system is broken. I mean, literally every day. And if someone doesn't say it to me, or I don't hear them at a conference or some event use the word that the American healthcare system is broken, you just need to open the Wall Street Journal or the New York Times. You just need to open Time Magazine or Forbes. You just need to read what has come from Harvard Medical School or Johns Hopkins. Every one of them use the same language. The American healthcare system is broken. And I will honestly tell you, for many years, I believe that to be the case. I've said, these are all bright people. They must know what they're talking about. Must be that the system is broken. And then I had a very strange experience that I'm going to tell you about that has nothing to do with the healthcare system that really changed my thinking about what is the reality of the US healthcare system. And it happened during my time in Boston. And this is probably kind of an odd story, but I actually owned, for a brief period of time, a Mazda Miata. And I'm a reasonably tall guy, and that's a pretty small car, but I loved that car. And there was a reason why I loved that car, and there had a number of reasons. It was perfect for Boston. First off, if you ever live in Boston, you know that parking is a bear, and particularly parking on the street is a bear. There are never any spots open. But that Mazda Miata could fit in nearly any half spot that was out there, so I could always find a parking space. And surprisingly, that Mazda Miata was great in the winter. It drove great in snow because it was so small. You could get anywhere where other people couldn't get in their vehicles. And in the summer, it was fabulous. You put the top down, drive up the coast of Maine or to the Cape or to Gloucester. It was perfect. Except one day I took my Mazda Miata to a furniture store. It's a store if you've lived in Boston, everybody knows it because every other ad is Jordan's Furniture. It's owned by Berkshire Hathaway. And I went to Jordan's to buy my first piece of new furniture that I was ever going to buy in my life. It was my late 20s. I'd been used, borrowed furniture and everything else. And so I was buying a couch. And I went into the store and found the couch that I wanted. And the guy that was selling it to me said, hey, you bought this couch, you have two options. You can either take it home with you today if you want, or we can deliver it to you. And it was a pretty egregious delivery fee. And I said, well, I drive a Mazda Miata. Obviously, I'm gonna have to have it delivered. And he said, man, did you choose a bad car? And I was like stunned, like I think I just told you, it was like the Miata was a perfect car, but yeah, it was perfect, except it wasn't also designed for that one time in my life that I needed to drive a sofa home. And in many ways, that is the reality of the US healthcare system, which is that I will tell you this, if you have cancers, particularly rare kinds of cancer, if you have significant need, complex healthcare needs, there is no system in the world that is better than the US system. People travel from all over the world to get care here. I have a company that I'm working with now, RightMove, which I'll talk about more, was spun out of this hospital in New York. It's called the Hospital for Special Surgery. Most of you probably never heard of it, but if you lived in New York, you most certainly have. It is the top, all it does is orthopedic care, musculoskeletal care. It is the top hospital for orthopedic care. It is so good that the Saudi royal family bought a building next to the hospital so that they could fly their people in to get the musculoskeletal care, the orthopedic care they need here. They don't do it in Europe. They don't do it in Southeast Asia. They do it in New York. And so I say that we actually have a system that seems to be working really well in certain instances, but has generated this perception that it's broken. And so I started to ask a question back on that Miata story. Maybe the system isn't broken. What if we actually started to say, maybe it's working perfectly, but it's based on what it was designed to do? That maybe the flaw, that the challenges we face is that we've used the wrong design approach to create solutions to address our healthcare needs. And I started to think more about that and started to talk to people about it. What became clear is actually, yeah, we don't have a broken system. We have a system that we continue to use the wrong design approach to care. And the way I'll just explain it is this: the approach that we've used for at least the last 50 years, it sounds overly academic, but I'll call it the balance interest approach to design. And it goes something like this: that if you want to create a solution in healthcare that works, you have to address a full range of the needs of the actors in the system. So you don't just address the needs of the patient, of the consumer. You need to address the needs of the payer, the health insurers, the employer benefit plans. You need to address the needs of the providers, the actual physicians and health professionals, the hospitals and the health systems. That you need to address the product manufacturers. You've got pharmaceutical manufacturers, device manufacturers, all these groups. And the way the balanced interest approach to design in healthcare goes is it says that if you want to create great solutions, you need to create solutions that address all of those groups' needs: the patient and the payer and the provider and the product manufacturer. And that sounds right. And so we've been doing that for 50 years. And the result of that is we have a system that we say is broken. And what we've actually found is there's a better design paradigm. And it's actually a really simple one. And it probably is a simple one for this room, because you think about the market we're in, with Walmart being the largest retailer in the world. It's a very simple design paradigm, and it goes like this: consumer, consumer, consumer. You want to build solutions at work, focus on one group. What are the needs of the consumer? What are the challenges that they're facing, that we're facing? How do I address those needs with solutioning? How do I recognize that providers and payers and product manufacturers exist to serve the needs of the consumer? And when you build solutions that work for the consumer, what you ultimately find is it works for everybody else too. And so that's actually what we've found. And the good news is we're starting to see more of that design approach. But there's another challenge that we face in healthcare in the US, and it is this: is that there's a perception that the American consumer of healthcare is the problem. That we as patients, as users of the healthcare system, that we are all stupid and lazy and ill-informed, that we're ignorant, that if we all just ate better and exercised and slept 8 to 9 hours and did things to reduce our stress, and if we all did all of our vaccinations and took our meds and did all of our checkups and that we wouldn't have these problems. so it's your fault. And so that is also a perception that has prevailed. So I'm going to tell you another story. And frankly, that's easy to get sucked into and believe. So this happened a number of years ago, that I was invited to Texas to be part of an event, a group that was going to talk about the challenges facing the Medicaid system. And Medicaid, for those of you who don't know, is the government program that helps provide health insurance coverage for those who are of greatest need, for lowest income. And so this was a full day event, and there were physicians and hospital leadership, and there were health insurance executives there, and there were government officials there, and government leaders, and there's a whole range of thought leaders. And if I could summarize, it was about an 8-hour event, if I could summarize in under a minute what the theme of that whole event was, it was this: that the problems we face in Medicaid are entirely due to the people who are enrolled in Medicaid. That it was those Medicaid eligibles, that if they didn't just always go to the ER for their care and instead got their preventative care, if they didn't just overutilize, expensive care and went and did the smart things. I mean, and to a T, every single speaker, that's really where it ended up. It was the fault of the people who are using the Medicaid program. And if they weren't, again, so uninformed, so lazy that Medicaid would work better. And then, this is a bit serendipitously, the next day I had to fly to South Texas. And I was meeting with a physician who was running a program in a number of Walmart stores where he was doing free health screenings. And these stores were in Walmart stores in Texas near the border of Mexico. And they were largely targeted to an underserved Hispanic population. And he knew I had gone to this event, and he asked me about it, and I told him about it and told him exactly what I just told you. And he said, well, let me give you a counter to that. Let me tell you about my experience in Medicaid, particularly in the state of Texas, where I live. He said that if you're newly enrolled in Medicaid in the state of Texas and you live where I live, for you to get on a panel for a primary care physician, and what that really means is for you to be able just to even have the honor of trying to schedule an appointment, 2 years. 2 years. So you'll wait 2 years to be able to have any primary care physician see you. And then when you get on that panel, you will typically wait. If you want to schedule and do a physical, or you're a diabetic and you want to come in and do a diabetic screening, how long will you wait to get an appointment? Somewhere between 9 and 12 months. So his challenge was this: is it lazy or stupid or ill-informed of an individual who has healthcare needs to say, well, if I go down this path of trying to go and get a primary care physician, I'm going to wait 2 to 3 years to get the care I need. Or I can go to the ER, because the ER has to see me and it has to take care of me. And so what we've actually found, and what we've heard over and over again, is that there's this perception of us as the American consumers of healthcare that we're the problem. But in reality, what we found, and the more I looked at it, is we've got it all wrong. Is actually we're not the problem. That the American consumer of healthcare is surprisingly sophisticated about healthcare, surprisingly informed about healthcare, but that the challenges that we're facing that keep us from engaging the way that we should and that we'd like to. And that there really are these kind of 3 factors that exist today that are keeping people from getting the health care they need. One is challenges of affordability. The second is challenges of accessibility. And the third is challenges related to complexity in the system. And I'm going to give you some of these facts. When you think about affordability today, out-of-pocket costs, consumer out-of-pocket costs for health care have grown faster, 30 to 50% faster than inflation. They have grown twice the rate of wages, so it costs us more to buy the health care we need than we've seen our own wages grow. But when you think about the impact of that, we know that over 50% of Americans in the last year have delayed or deferred necessary health care they need because of cost alone. By the way, I'll tell you that at least a quarter of Americans don't even really need much health care in a given year. So we have over half of Americans who are delaying because of cost. We have almost a quarter of Americans who are delaying very necessary care for over 12 months because of cost, because they can't afford it. On things like dental care and vision care, 55% of Americans delayed necessary dental care because of cost. 45% delayed vision care because of cost. A quarter of Americans didn't do an annual screening in the last year. These are people who needed it because of cost. So cost is a big challenge. When you think about accessibility, we've already kind of talked about it a bit, but when you think about how long it takes you to get appointments, you know, if you try to schedule you want to do your physical today, again, you're going to look at least 3 to 4 weeks delay for you to get that appointment. But if you live in an underserved market, you're looking at more like 3 months, could be 6 months. But not only that, when you look at the investment made to get the care you need and how often inefficiently that is delivered, you might, if you want to go to a doctor's appointment today, you might spend a half day, you might spend 2 or 3 or 4 hours just trying to, you know, get in to see that doctor, get the care you need. And you think about the impact that has on your life. You've got to work, you've got to take care of family. So that inaccessibility, that inconvenience is significant. But I think the worst and most egregious piece that is on here is the complexity. This fundamental belief that we all have that the American healthcare system has intentionally made itself complex so as to discourage us from getting the health care that we need. And the result of that is, and I think it's a pretty staggering number, 81% of Americans who engaged in the healthcare system in the last year say they were wholly unsatisfied with the healthcare experience that they had. So you put this all together, and we've got a real challenge. The good news is the market has tried to respond and has attempted to address, I think, in a reasonable way, these consumer needs. And you've seen it through the rise of a whole bunch of new options in care delivery. Some of these are probably ones that you're familiar with, others maybe not. But when you think about in the bricks and mortar side, you've got the rise of retail clinics. So groups like Minute Clinic at CVS or Take Care at Walgreens. You've seen the rise of concierge healthcare. So groups like One Medical, where you pay a membership fee and you can access, you have more accessible primary care available to you. You can even text your doctor. Or MD VIP and others. You've seen the rise, particularly for those who are over 65, of value-based healthcare solutions. So groups like Oak Street, Iora, ChenMed, these are probably not names that many of you know, but we've seen the rise of those. And so there are a lot more kind of innovative bricks and mortar offerings that have come up over the last kind of 10 to 15 years. We've seen the rise of virtual and digital health solutions. So telehealth solutions like Teladoc, American Well, Doctors on Demand. We've seen the rise of direct-to-consumer virtual solutions like Hims and Hers and Roman, so you can get your erectile dysfunction meds online as opposed to having to go see your doctor. We've seen the rise of digital health apps. We've literally seen thousands of them. Groups like Livongo in diabetes, or we've seen the rise of or Hinge in the virtual physical therapy space. And we've seen the rise of at-home and mobile solutions, tons of them. So groups who will come to your home and deliver you care, particularly for seniors, so Signify and Landmark. Mobile solutions, so the idea that that somebody could meet you in a parking lot near your home, like Leidos. So great, we've seen a massive amount of new vertical care delivery solutions. The problem is it really actually hasn't addressed the consumer needs. And what we've seen is this rise of multi-channel healthcare has actually just created more confusion for the consumer, for us as consumers. And that in many ways we just see them as competing. And so that approach has not been as effective as we'd like. And this is what I think gives rise to the real opportunity that we're seeing, which is this move from multi-channel thinking. We don't need just another digital health app. We don't need another virtual healthcare solution. We don't need another bricks and mortar healthcare solution. We don't need another in-home solution. What we need is solutions that actually bring them together, that are not multi-channel, that are omnichannel. And I'm going to give you the definition for omnichannel before I talk about what we're kind of seeing in omnichannel healthcare. But this is a definition from Frost & Sullivan. I like it. But their definition is this. Omnichannel it is seamless and effortless, high-quality customer experiences that occur within and between contact channels. And I want to highlight a few words here. Seamless, effortless, high quality. But the key one is this: within and between contact channels. In other words, it's not about in healthcare, it's not about bricks and mortar care and virtual care and digital care and in-home care. It's actually about experiences that get created by bringing all those types of nodes of interaction together into new experiences that they interact and integrate to enable more seamless, effortless, higher quality experiences for the consumers. And the good news is we're starting to see these omni-channel experiences in healthcare arise. And for all that was awful about COVID care actually represented the first major scaled omni-channel solutions in healthcare. And what did it look like? Well, when you couldn't go into your doctor's office anymore, when there was a risk that you might have COVID, you saw a lot of groups pivot to omni-channel solutions. What do we mean by an omni-channel solution? I'll give you an example of one that we saw was a physician group who was in Georgia. You thought you might have COVID, you wanted to get tested, great. What you did is you went online, they gave you a little site, you could schedule an appointment to come in and get your COVID test, but you didn't actually come in, you drove to the parking lot in front of their clinic, you pulled into a special spot. When you did, you scanned the QR code on the front of the little sign, it sent a signal into the clinic to send out a nurse. The nurse walked out, she came up to your car, you rolled down your window, she ran the test, she went back inside, you drove away, and by the end of the day or early the next day, depending on what kind of technology they had, you got a text that told you the result of that test. Well, that merger between a digital experience, a web-based experience, a text-based experience, a physical bricks and mortar setting, it sounds not all that interesting, but honestly in healthcare, it was one of the first times we had seen that kind of integration between a digital experience and a bricks and mortar experience. But now these experiences are showing up all over. And I'll give you an example of a checkup. How many of you have actually gone in and gotten some sort of an annual physical or checkup in the last year? Okay, so I will describe an experience that is most likely the experience you had, which is it goes something like this. And particularly if you're a little older, you scheduled an appointment with your primary care physician, you sat down with him or her, or you went in and you sat down and they started to do a bunch of stuff, asked you a bunch of questions and and went through this whole exam, and then maybe at the end of the exam they said, oh, by the way, I'm going to send you down to the lab and I'm going to have some blood drawn, and so great, you've gone in for your appointment, and most of the appointment was focused on running tests. Except at the end of that appointment, if you had a cholesterol test run, an A1C or a glucose test run, they didn't have the results. So you went to your appointment to understand what was going on with your health, and you actually don't really have any answers. You're not going to get those answers until afterwards. So what does the new experience in primary care look like? And we're seeing it right now. You schedule your appointment, maybe you schedule it online, and that immediately triggers a kit to be sent to your home. It arrives in your home within the week. You open up that kit, and it is a home testing kit. So you do your own sample, you spit in a tube, you prick your finger, put some blood on it, you send that in immediately. Then you show up, one other step, a few days before your appointment, you get a text that says, hey, we have some questions, and we're going to actually direct you to this bot, this AI bot, that's going to ask you a bunch of questions, and you're going to have a conversation with it. They're going to ask you, do you smoke, do you drink, and do you do a bunch of things, and you're going to answer these questions, and it's an intelligent bot. Based on how you answer questions, it might ask you more questions, and you'll have done that a couple days before, and then you go in for your appointment, and what's different about your appointment? Well, now instead of spending 45 minutes in that exam room where most of it's just you being poked and prodded and asked questions, you don't need to be poked and prodded and asked questions. All the questions have been largely asked. All the tests have been run. We've seen a group who actually, if you needed to run an EKG, they send you a home EKG solutioning, so you've run your EKG before you even show up. Now your doctor comes in the room and says, hey, here's what all I know about you. Here's what's going on about your health. Here's what I'm concerned about. Here's what I think you should do about it. You think there's this concept of moments of truth. Well, this doctor now is coming in, and in that moment of truth actually can do something to help you address your healthcare needs. And so we're seeing that. In the space that I work today, as I mentioned, I work for a startup, RightMove, that got spun out of this hospital in New York. When you think about musculoskeletal care, there's a good chance that at least half this room in the last 12 months has been dealing with some musculoskeletal issue. There's a reasonable chance that you've had some sort of injury, knee injury, ankle injury, back injury, shoulder injury. Maybe you're just dealing with chronic pain in your knee or back or neck. Maybe you've got some mobility issue. You can't even raise your right shoulder above, this. Whatever it is, there's a very high probability. In fact, there's a greater than 50% probability that you've had that occur in the last 12 months. And you think about, okay, well, let's imagine a situation. This is actually a real situation. Let's imagine you're a guy, because this actually happened a couple months ago. Let's imagine you're a guy who, over this last weekend, you were working in the garage and you did something to your left elbow, and all you know is that the pain level you're feeling is an 8 or a 9 out of 10. It's enough that it's making you almost cry. What do you do traditionally in the non-omnichannel world? Well, most likely what you're going to do is you're going to call your primary care physician if you got one and try to get in to see, again, her or him, or you maybe go to urgent care and try to see them. Great, so what do? Well, most likely it'll look something like this. They say, see, you've got an elbow issue and you've got pain. They try to treat your pain. Maybe they give you gabapentin. Maybe they give you opioids, God forbid, and they refer you to a specialist. They refer you to an orthopedist. And maybe if you're lucky, you get that appointment in 3 weeks. If you're likely, you get it in 6 weeks. So you're going to deal with that pain for a lot longer. You're going to take those meds for a lot longer. And in the end, you go there, and by the way, most orthopedists, they're surgeons. What are they going to do? There's a high likelihood they're going to recommend surgery. So when you think about this, that's the reality we face today. It's also the reality of why in the United States, over half of the knee and hip and spinal procedures that are done are deemed to be inappropriate or unnecessary. So that's the typical path. So what's a new path look like? And this is what we've created at RightMove. What if instead you've got an issue, you could be seen today or within the next 24 hours digitally, virtually, by a provider who is uniquely trained around musculoskeletal diagnosis. And in that setting, in a 45-minute or less setting, they take you through a set of tests, and at the end of that, you get two things. Of this exam, you get two things. One is clarity around what your issue is, and clarity around a care plan. Who should you be seeing for your care, and what's the care they should be providing? And out of that, then it's deemed, and let's go back to this guy that we just talked about who had the elbow issue. This is actually a true story. He came in to us and had said, I've injured my elbow, I'm certain I've damaged it, I'm certain I need surgery. I've already called, he actually bypassed primary care physician. He said, I've already called an orthopedist because I'm pretty confident I need surgery, but but I'm just going to do an assessment with you all anyway. And so we did the assessment with him, and in 45 minutes, here's what we found. He didn't have any elbow issues. He had exacerbated a bulging disc in his neck and a C6, C7 vertebrae in his neck. The good news was he didn't need to go see a specialist. He needed to go to physical therapy. He needed to go to in-person physical therapy. And that even better, because we created a clear plan that was based on data that he didn't need to go for the next 3 months. We were projecting that he only needed 3 visits over 2 weeks. But even better than that, because we did this all digitally, and then we're able to find him a high-value physical therapist in the community he lived in, we were able to communicate digitally with that in-person physical therapist. We injected the care plan that we had into that physical therapist system. And so when he showed up to the physical therapist wasn't asking, why are you here again? What is it you need? Had a very clear sense of the diagnosis, had a very clear sense of what that person did, and began to immediately treat him the second he was in there. And the result was actually, what the guy would now tell us, is after the second visit, he went from a pain level of 9 to a pain level of 0 within a week. That was, again, that's the value of omnichannel care, this merging of a digital experience and the integration with a physical experience to fundamentally address the consumer needs in a very different way. And so I think that's the opportunity that when we think about the role of technology, one of the big areas that technology is going to play a more important role is enabling these omnichannel experiences. And what do we see as the benefit of omnichannel experiences? There's really 3 things. One is improved consumer engagement. And this is the ball game. Healthcare sucks at consumer engagement. It's awful at consumer engagement. And so doing things that make it easier for us to engage is a good thing. And omnichannel improves our ability to drive consumer engagement. But it also does something else that's quite interesting. It actually improves efficiency in operations, and it actually enables us to better use our high-cost labor. Doctors are expensive, nurses are expensive, specialists are expensive. Healthcare labor is expensive. And so omnichannel solutioning actually enables you to better use that labor in a much more effective way. And so when you put it together, the benefit of omnichannel is not only does it address, we talked about the consumer challenges earlier, does it improve accessibility? Does it actually make things simpler, not more complex? But the other thing it does is it lowers the cost to operate, and when you lower the cost to operate, you can make things more affordable. So omnichannel has great benefits. But I'm going to close on this point, which is omnichannel isn't enough. That we've got to do more, and that we certainly have got to lean into innovation and technology to find ways to further simplify healthcare in America. And this includes the use of artificial intelligence. And I'm going to give you an example that's actually close to home here. So there's a health system, Parish Healthcare, that they publish this thing every year, which is the top 5 bad health habits that increase risk of disease. And what they really mean by that, the bad habits that those of us as healthcare consumers do to increase our risk of disease. And number 4 on the list is this, is the foregoing of physician-recommended cancer screenings. And so I'm going to give you my experience with one of these. So one of those that is often foregone, more than it should be, is for women breast cancer screenings. So some number of years ago, I wanted to understand the breast cancer screening process, which, if any of you know, requires you to go do mammography. So I was like, well, I'm going to go do a breast cancer screening. And for those men who will never do it, let me tell you how lucky you are. So I went in and I walked up to a machine and they squeezed my pec into this machine, and they squeezed it so hard I started crying. And it was fair. I thought it was generally degrading and everything else. But I did it, and I ran the test, and they came back and they said, "Oh, good news, we don't think you have breast cancer." And then I see weirdly to the week, a week later, this article on the left, which was in the New York Times, vast study casts doubts on value of mammograms. That this prime technology that we've been using for decades to assess breast cancer, screening or doing breast cancer screenings and assessing breast cancer risk, that maybe these aren't really that effective. And then, as luck would have it, fast forward, there's actually a company in Fayetteville, Arkansas, who had developed a test. And they had found these, based on fluid that is actually in your eye, that you could capture just by dabbing the corner of your eye with a tissue, that there are markers in that fluid that are indicators of whether you have breast cancer or not. And that you could very simply just ship this test to everybody in the US, and as long as you can just take this little napkin-y thing and dab your eye in the corner and capture a little, natural fluid that's in your eye, you can put that back in the kit, send it on, and it will come back and tell you whether you've been deemed to have a breast cancer risk. And even if you follow the clinical protocols, for those individuals that it says, yes, we think you do have this risk, yes, you would still need to you should go do a mammogram. But you think about that kind of innovation. That kind of innovation is popping up everywhere across healthcare, not just in diagnostics, but in this idea of solutions that can simplify the consumer experience, that make it easier to access, more affordable, in this case, less painful. You don't need to actually, be physically harmed to do a screening. And we're seeing this sort of everywhere. Our challenge is that the system really struggles to engage this innovation in an effective way. And at times, it doesn't want to do it because I make a good amount of money doing mammograms. I think our challenge is we've got to continue to lean into innovation. So that's one point. One last point that I'd also make is there's a lot of conversation, and this, for many of you, maybe you've not heard this term, but there's a lot of discussion in healthcare, in the US healthcare system, about the need to move to a value-based system. And what that really means is this, is that historically we have healthcare, the way it's paid and engaged is through a fee-for-service environment. What that really means is if you go in and you get a test run, we pay you for the test. If you get some little procedure done, we pay you for that procedure. So it incentivizes volume. The move to value-based, fee-for-value, is really about maybe we shouldn't pay people based on the things they do, but we should pay them based on the outcomes they produce. Said differently, what if we started paying doctors and hospitals and health systems not for every procedure and every test they ran, but instead paid them for helping each of us maintain our health or be healthier. So it's based on health outcomes. So there's a lot of conversation about this rise of value-based care. And there's a lot of work, and there's billions and billions of dollars of investment that's gone into it. And I would tell you right now, to date, it's largely been a failure and been unsuccessful. And I think, but we're learning a lot and we're trying. But the challenge, and this is why I think it's a technological challenge, is when you actually understand the needs of the consumer, and when we talk about it, creating value, there's enormous opportunity. And so if you're an innovator, if you're an entrepreneur, I think there's an enormous opportunity to define value-based care will come to fruition. But we've got to do better at building solutions that actually create real value. And I'll give you, and I'll kind of close on this story, this example. Some number of years ago, it was actually back in Texas. It feels like I spent a lot of time in Texas. But I had the opportunity, and I was sitting and I was listening to this woman. She was being interviewed, and there were a number of healthcare execs that got to listen to her talk. It was this woman that she was 44, 45. She was married. Her husband was 47. She had 3 children. One was in 8th grade, one was a sophomore, and one was a senior, and they were just starting their school year. And she had also shared that her mother-in-law had just moved in with her. And then she shared this story. This had all kind of happened in the last 4 weeks leading up to this interview. That I believe it was her sophomore had gotten a letter home from school that said, hey, your kid is missing 2 immunizations, and if she doesn't get these immunizations done in the next couple weeks, not going to be allowed in school. The youngest, that was an 8th grader, was a boy, had recently been diagnosed with an autoimmune disorder that had created some skin issues. And there was some question about, yeah, there was some medication you could take, but there was also diet changes that needed to happen, some other things that could help address this issue. And then the senior played football, but also had sports-induced asthma. So there was some requirement in the state that if you wanted to get approved to play a sport in high school, you had to do an annual screening, an annual exam. But because this son had asthma, they had to get it from a special kind of provider, and they were struggling to find a provider that could get them in, that was approved, that could get them in fast enough to get the screening done. And then she also told the story about her husband, who his best friend was 45 and had just gone in to get his first ever colonoscopy. And I guess over beers, they were talking about that. And the husband, who was 47, had never had a colonoscopy. His doctor had never told him to get a colonoscopy. But he was freaking out because he said, well, my friend told me that you're supposed to do it at 45, but no one's ever told me, should I be doing this or should I not be doing this? And if you hear my voice that I'm getting a little more frantic as I go along, that was how she was acting. And then we get to the mother. And what she dropped on everybody in the room is, well, they didn't just move in the mother, but the mother had just been diagnosed early stage dementia. And they're moving her in the home, and she's trying to figure out how to take care of her, and she didn't know what to do because she's never dealt with anybody who has dementia in her life. And this woman is in like full on in front of us panic attack. Like she is freaking out. And person next to me, who's a healthcare exec, his response to it all is like, well, you know what this woman needs? She needs access to mental health counseling. She's dealing with severe stress and anxiety. Wouldn't she benefit from therapists? But this mom said something very interesting. She said, and my family spends a lot on healthcare. We spend a lot on insurance and other things. And they know all this stuff about me. They know my husband is 47. They know I'm 45. They know my son, who's the oldest, has asthma, sports-induced asthma. They know my child, who's in 8th grade, has this autoimmune disorder because it came through the system. They know my kid, my sophomore, is in high school, and they should know that it is known what immunizations my kid needs. What I want to know is, why are we spending all this freaking money on health care, but they're doing nothing to help me know what the heck to do? And she actually used a little bit more colorful language that I won't use with you. And she said, why isn't somebody reaching out to me and saying, I know your child needs these 2 immunizations, no problem. We've already got you scheduled. You can go down to the Walmart or the Walgreens or CVS pharmacy, or we can have somebody come to your home when it's convenient to you to get those done. We'll do it over the summer. You just let us know. Oh, we know that your child that just got diagnosed with autoimmune disorder, good news, we're going to have an educator reach out and find some time. We're going to send you some materials, but find some time to help educate you on what you need to know about that disorder and the things that you can do to help your child. We know that your child has sports-induced asthma, no problem. We've already scheduled the appointment with the doctor who can see you. We've got it scheduled in August. We're going to do it well before school starts. And yes, your husband does need a colonoscopy, no problem. We've already scheduled and helped organize a men's health screening for him, and we're going to take care of all the things that he should be doing. Plus, here are the immunizations that he needs now that he's turned 45. We can take care of that. And you've let us know that your mother-in-law has dementia. We've got a program, a care program, not just for her, but for you, that actually provides counseling support to help, one, educate you on what it means to care for a family member with dementia, but also is there to give you support through that process. Everything I just described, those solutions exist out there. But the problem is no one has created a way to bring it all together. And so when you think about the power that innovation and technology can bring to healthcare, in my mind, it's actually that. It's going to be who enables us. We want to create value-based care in America. That's value-based care. That mom described it in a heartbeat, which is bring me a solution that helps me get out in front of it instead of me having to chase it all down myself. And so I think that's the opportunity, that we want to create a more engaged, we want to have Americans more engaged in their health care, that we need to actually create a system that leans into innovation, that is using technology in a proactive way to enable us to engage more upfront, to be more aware. That's the opportunity that we face. So again, that's enough of my preaching for today. But what I will say, again, thank you for the opportunity to come talk to you. I do hope that many of you will pursue opportunities in healthcare. I will say this about Northwest Arkansas, that I think what is happening here right now, this was not when I first got here just under 20 years ago, I wouldn't have defined Northwest Arkansas as a healthcare market. And in some ways that's good, because it didn't come with all the baggage and burdens, that it allowed this market to create a different perspective. But you look at what's going on now, and you look at the rise, the enormous amount of innovation, the rise of the Whole Health Institute and the new medical school. You look at the program with Mercy and Cleveland Clinic and others. You look at just what's happening kind of collectively, the number of startups in healthcare that are emerging. This is actually a really interesting place. And you look at having many of the largest employers, Walmart, J.B. Hunt, Tyson, and others. This is one of the more interesting places to think about healthcare. But I think, again, my challenge to you is the solutions to address the needs we have in healthcare. They demand innovation, they demand technology, and more than what has happened today. And so if I could encourage any of you, even if one of you is motivated, I think there's enormous opportunity in healthcare, enormous opportunity in technology in healthcare in Northwest Arkansas. And so I hope you will consider that as a path. So with that, I'm glad to also take some questions.
Yeah, we'll do some Q&A. So please, we've got a microphone here and here. We've got Marcus. There's not a smarter person here on the healthcare side of things. So this was a similar question I asked Cyrus about smart mobility yesterday, is just the role of the business community in helping to encourage this, the role of elected officials. So this is my perception, and you can help me. So we've got this amazing opportunity to help screen cancer or breast cancer through tiers. And I imagine there's companies that are making all these machines and that may or may not be in support of that. And there's legislators that are, wanting to support capitalism. And so how do you make that transition to that innovative style when there's money to be made and we're sort of a capitalistic society?
Yeah, it's a good question. So, I mean, let's go back to this reality here. So as we mentioned, you've got a number of large employers, but you've got three very big ones in Walmart, J.B. Hunt, Tyson Foods. You've got the University of Arkansas which is a major employer, not to mention the school districts and other. Here's the one fact that you need to know. If you look at the income statements of large employers in the U.S., does anybody want to guess what the fastest growing expense item is on their P&L? Medical benefits. Providing health insurance coverage for your employees. It has far and away been the fastest growing. I think, I'll get the sort of facts wrong, but I think in the last 20 years, I think 18 of the last 20 years, it was the fastest growing expense item for employers, large employers in the US. And I say large employers, if you're a small to mid-sized employer, you actually are, as tough as it is for groups like Walmart, JB Hunt, and Tyson, if you're a small to mid-sized employer, you're getting screwed because your costs have even grown faster. And so I think my point on that is to say that these employers, you can say, oh, do they have is there some, should they do it because it's the right thing to do? I'd actually say if you're the CEO or the CFO, it's the right thing to engage in and do because the way the system is working is massively impacting your P&L and the financial performance of your company. I would tell you that these sort of healthcare challenges we described are massively impacting the productivity of your employees. So when your employees have an inefficient system and an ineffective system, that means that healthcare is going to cause them to be out of work or to miss parts of days just to get the healthcare they need. So I'm just talking about benefit expense, but when you look at the cost that the challenges that healthcare brings to productivity and how it impacts productivity, we know this is an interesting data point. Musculoskeletal injuries surpassed caregiving as the number one driver of declines in productivity in the U.S. over the last 24 months. In other words, people's physical injuries were more than, I had to take care of my kid or take care of an aging parent at home, were the biggest driver of causing people to be absent from work, so absenteeism. So my point on that is, I think that's the opportunity, is that these employers and these groups are recognizing, and government officials, I mean, in most states, Medicaid is the number one budget line item. And so when you recognize that, you can't really sit back, because if you don't get involved and figure out how to lean into innovation, you're going to continue to see healthcare be a major driver of expense. You're going to see healthcare be a major lag and drag on productivity. You're going to see healthcare as a major driver of cost on your state budget line items and everything else. So I think that's the driver, is that if you don't get involved, well, then you're going to pay the price, because you're going to have less profitability. You're going to have to raise taxes to cover the cost of Medicaid. You're going to have to, it's going to be harder to retain employees. So I think that's the thing that should be driving everybody to the table to look for this innovation.
Hi. So to your point about the public perception of the healthcare system being broken, and specifically the affordability part of it, it seems to me there's a common perception that things in the U.S. healthcare system just plain cost more than they need to. And I feel like we often see stories of the same medication, same procedure, et cetera, in Canada or some other country might be a lot cheaper. So maybe the pessimistic explanation that I hear from some people is that it's just plain disproportionate profit taking from unregulated, greedy private interests. Do you think there's any truth to that sort of pessimistic way of seeing it? And do you think innovation and technology is a match for something like that? And yeah, I guess that's the question.
Yeah, look, on the base of it, I would say things in the U.S. cost more than things in other nations. So I will get that. But I actually do think I think that's false, and I'll tell you why. The reality in the U.S. healthcare system, $3.8 trillion spent roughly on the U.S. healthcare. The thing that nobody talks about is, of the $3.8 trillion, $750 billion of EBITDA, of profit before interest, tax, depreciation, and amortization. So it's a surprisingly very profitable business. There's a lot of profit in it. So it's not like the industry's hurting in the way they like to say they're hurting. But I'll give you an example of something where people would say that, it's just the cost of doing, these things are expensive. In Boston, Mass General Hospital, Brigham and Women, major health system there, they had this chronic disease program run by physicians. It was shown to be reasonably effective, but it was expensive, right? If you had somebody who was on diabetes, they needed to pay. The program cost was about, I think about $6,000 to $8,000 a year to really be in it, but they were showing reasonably good results. There was one of the guys that was involved with it who said, he started to look at the care that was being delivered, and he said, this is kind of strange. He's like, I think I can systematize most of this. And he had this wild idea. What if I could put it into a technological system in a program and then train in a very limited way graduate students? And by graduate students, he wasn't talking about graduate students who were doing healthcare. He was talking about people who wanted to be economists or philosophers to do chronic disease management. And so he built this program, he built this system with a bunch of people, and they trained a bunch of grad students. And their price, and they went out to market, and they did this chronic disease, the same kind of, or similar program. The cost was 1/8 of what the traditional physician-based approach was. And the interesting thing is they got 3x better results using PNPs. And PNPs is a term that I use a lot that I sort of stole from an individual that was the head of benefits at Walmart. PNP stands for professionally nice person. It was not somebody who went to college or went and became a physician or a nurse or had any kind of special healthcare degree. They were literally just a nice person who got great technology. So I think what we've continued to see is there are certain things that are going to be expensive, right? Innovative new drugs that come out are going to be expensive. But the reality is, I think we've kind of convinced ourselves that healthcare in the U.S. just needs to be expensive because that's the way it is. And the reality is I don't think that is the case. I think there are ways, as we expose ourselves, there are ways to find new approaches. And even on the pharma side, we're finding that a lot of these new or expensive products that are coming out, that there are kind of older products that maybe are generic that actually are, that we could be using that are almost as effective. And so I think that's the challenge that we have, is that we shouldn't just naturally assume that healthcare in America has got to be really expensive. I think that's a mistake.
Thank you.
First of all, amazing presentation. And second, what ways are we trying to implement AI into the omni-channels right now? And if so, are there any major concerns we need to look out for?
It's a great question. So I will tell you what the industry is saying, and then I'm going to tell you what I'd like to see as well. So the industry is very, the healthcare crew is really, really nervous about AI. And I think it's because they're scared of its real potential. So what you will hear is the two main uses of AI right now are around efficiency and administration, and what that's really code word for. And most of you probably didn't know this. We'll use primary care as an example. The typical primary care physician or the nurse practitioner or nurse in that practice in a given day will spend 30 to 50% of her or his time doing administrative tasks. So what that really means is, if they're not there for 10 hours, but if they were there for 10 hours, they would spend anywhere from 3 to 5 of those hours not taking care of patients, but trying to figure out coding and billing and all this stuff. And you think about that in a market where we're struggling to have enough providers, you want to free up providers? Reduce their administrative burden. How do you reduce their administrative burden? Use AI. So there's a lot of talk about AI as a mechanism to reduce the administrative burdens in healthcare. The second is this thing called clinical decision support, where it's this idea of use AI as an angel on the shoulder of health professionals to help guide them on the care they should be delivering. So this idea that you're a doctor and you use AI to assess a lesion on somebody's arm to determine whether it's cancerous or not, and it sort of makes a recommendation. So that's great. The one that nobody's talking about, and it's the one that I'm actually the most excited about, is this. It is AI as care provider. meaning there is a lot of what we get in healthcare that is, that healthcare is not an art, it is a science. And it is following the kind of right approach. And so the idea is that can AI-based solutions, maybe not today, but down the road, assess you, diagnose you, use data and insights to determine the right care and treatment approach? The answer is yes. But I'll tell you is most people don't want to talk about that, because what that really is in code word for is, are you saying that AI is going to replace physicians? No. Like there's always going to be a role for physicians and providers, but I think what my hope is, if you look at the challenges we have at getting people to have access to the care they need, what AI represents is the opportunity to create a more affordable, accessible, and simpler way for people to address a lot of their basic care needs. And that and what that really translates to is a changing role of what the provider does, which is maybe they don't need to be involved in every single interaction, but they're acting more as this sort of coordinator for care. And so my hope is that's what we'll see, is that you're seeing a lot of investment in the first and the second. I don't know whether we're not seeing a lot of investment in the third, or people are doing it, but they're doing it so quietly because they don't want anybody else to know that's where they're investing. But that's actually where we need to get to, ultimately. Okay.
Great presentation. I think everybody in this room, including me, would agree, because we have all experienced whatever you have mentioned about the broken system. I personally not sure really is the reason the lack of the technology not being available really to bring down the cost of the healthcare or fix the broken system, or is lack of some leadership really really that can bring all of the players together to solve this particular problem and ask for what is the technology that they really need to solve this problem. For example, like Walmart solved the problem for the retail by really opening stores almost every part of the country there and bring really affordable prices to everybody in the nation. I'm not sure who the Walmart is going to be for the healthcare system to bring all of these lobbyists and insurance and everybody together to really solve this particular problem as a whole.
Yeah, I mean, I think you're right. I'll make sort of one comment, last comment on that, which is, there is a challenge of how you bring everybody together. That's easier said than done, and the bigger the industry you're in, when healthcare is nearly 20% of our entire gross domestic product, as I mentioned, when it's a $3.8 trillion industry, when there are so many companies who have so much vested and are making so much in this industry, trying to convince them to come together and work together in new and different ways, where the result might be it impacts their financial performance has proven to be a challenge. And I think that was the hope of the rise of groups retailers and technology companies like Google and Amazon and Microsoft and Oracle, others. The one comment I will make is that, and we've sort of seen it in the last year, is that there's been a lot written about, there have been a lot of kind of stop moments in healthcare, and particularly in retail. Walmart's exit of Walmart Health. I think the challenges that Walgreens is having, that their share price went from at one point being in the 90s to now 9, and their challenges with VillageMD. Dollar General exited their singular healthcare services venture. CVS, just got rid of their CEO, and so it looks like a moment and the reaction is a lot of people sort of said, "See, we told you, healthcare's hard. Leave healthcare to the healthcare people. Leave healthcare to the healthcare companies. You retailers, you technology companies, you financial services groups, stay out of it." I will say healthcare is hard, right? But at the same time, I think that, and my reaction to all that is, every one of those groups, when you really engage with them, is learning. And they're learning what works and what doesn't work. And my hope is they will take that learning and sort of create the next innovation, and the next innovation, and the next innovation. Because I think to your point, yes, we need to bring everybody together, but if you think that the answer is going to come by getting the health insurers and the health systems and whatever to come together, like, I wouldn't bet on that anytime soon. I think it demands these non-traditional players like retailers, technology companies, financial services companies, strangely food service companies, whoever it is, logistics companies coming in and saying, we're going to come in, we think we can bring something to this industry. Because when they do, it puts pressure on everybody else to be innovative, to collaborate in ways that maybe they didn't collaborate before. So that's my hope, is that, yeah, it's been a rough year, particularly for the retailers, but I actually have hope that there's actually more to come, that there'll be a rebound.
All
right.
Try to get into the health sector.
Yep.
And people were hoping that it will solve this particular problem in the system and will bring down the cost of the healthcare. But unfortunately, even that died down for various reasons.
That's right. That's right.
All right, thanks everybody. Sorry to cut it. Well, we didn't cut it short. We went long. So let's give Marcus a round of applause.